Okay, this is the second installment. What we just talked about with cognitive behavioral therapy and Beck's understanding of ABC, understanding of human behavior, also equated that to the think, feel, do cycle. There is a technique known as TF, CBT, and I'm trained and supervised in this technique. It stands for trauma-focused cognitive behavioral therapy. And I mentioned these things here like think, feel, do, cycle, TFCBT. These are all evidence-based practices or techniques. I really like folks in the field to employ these because they've been shown to work. So trauma-focused CBT has been shown to be effective in reducing symptoms of PTSD, of depression, of anxiety. The one thing that you want to be sure before you employ this whole technique is that somebody actually meets diagnosis for traumatic stress disorder, post-traumatic stress disorder. Otherwise, there's parts of this component that, or parts of this technique that just won't fit. These are all cognitive behavioral therapy techniques. There are a couple of other ones that I'd like to bring your attention to. And this was news to me. So I was not familiar with ACT. And according to your text, this is acceptance and commitment therapy. And the way I understand ACT, acceptance and commitment therapy, is allowing people, it's supposed to be more open-minded for an adolescent. It's supposed to be less judgmental. In other words, we're not so much imposing our values onto the adolescent. We are asking the adolescent for their honest appraisal of their own feelings, their own thoughts. And so it is kind of the cognitive behavioral kind of thoughts and feelings. We are dealing with those things, and then consequential behaviors. But we are asking adolescents to identify emotions. This is very important because many times people, young children, especially adolescents, don't understand everything that they're feeling. They don't give voice to everything that's going on inside of them, and then that comes out through behaviors. And a lot of times those don't make sense because we don't understand, well, where did that come from? We didn't see that coming. You know, this seemingly impulsive reaction or behavior when it could have been like a boiling kettle and finally reached a tipping point where it all boils over. So we really work on identifying feelings, and instead of the think, feel, do, where we were telling people, no, you need to change that angry feeling or that feeling of sadness so you do something different. In this model, we want people to identify them and accept them. Acceptance. Accept them for what they are. But when they figure out what they are, when they identify them, we use a mindfulness technique. In other words, we try to separate the emotion, the feeling, from the thoughts. In other words, we're trying to intervene right here and want people to be like an objective observer. Let's think about that feeling. Let's think about, in fact, let's also step outside and think about those thoughts that are leading to that feeling. So mindfulness is a meditative practice. You allow people to become very grounded, very relaxed, and it's more accepting. And the crux of the technique is then to allow the adolescent to then make their own choices and commit to how they're going to respond to these thoughts and feelings. Very, very nuanced technique. I am very excited about it. It's, the research is very new. The researcher Bass from 2014, they repeatedly cite. So that's not something that I was privy to when I went through school or even in the past few years through practice. So excited about that model. Go ahead and read on page 43. It says, the provider encourages the adolescents to be aware of negative thoughts and emotions. But ACT does not focus on rejecting these cognitions. Instead, the focus is on helping adolescents to accept them. ACT encourages the adolescents to detach from the emotional feelings that these cognitions provoke and approach them with objectivity. In other words, the adolescent is then like an outside observer looking in on their own thoughts and their own feelings and even their own behaviors. In a way, CBT does that by drawing this out, but you're allowing them time to accept what's going on. If you go down to the middle of the page, that last column on page 43, one variation is that MDT, so the mode deactivation therapy, which is mentioned previously in the chapter, DBT, dialectical behavior therapy, and ACT are less judgmental than CBT and focus on allowing the adolescent to have more control over decision making, which is encouraging because adolescents lots of times don't tell me what to do. My parents already tried to tell me what to do. This can be really helpful for adolescents who have not sought out treatment. In other words, they're mandated to go to treatment. Another difference is that DBT and ACT use mindfulness as a core component. It goes down a little bit more. MDT has proved to be more effective than CBT, with adolescents displaying aggressive behaviors, and DBT has been more effective when treating personality disorders. So keep that in mind. In other words, I like people to approach therapy and approach clients from the mindset that, kind of like a doctor. So let's say that you're a nurse or a doctor, and a patient comes into your office, and they're complaining of sore throat and fever, 101 degree fever. So what are you going to do? So you're going to look in their throat, take their temperature, blood pressure, all that stuff. And you're also going to do what? You're going to use a little swab, those little swabs back there. Probably test for strep throat. There's some pus on the tonsils back there. And you get back your really quick screen for strep, and it says it's strep positive. So what are you going to do as a physician? You're going to prescribe amoxicillin and feel very comfortable and very confident in your prescription. Why? Why? Because there's a lot of evidence that says prescribing amoxicillin for strep throat is going to alleviate it and cure it. I want you, as a clinician, as a therapist, as a school therapist, whatever your role is, I want you to feel that confident that when somebody comes into your office and starts talking to you and you start hearing symptoms, I want you to, wow, this seems like it's trauma. I'm going to be able to do some TFCBT and alleviate those symptoms. That's my evidence. And then you're going to feel confident. What's cool about therapy right now is not like it was when I was an undergraduate 20 some odd years ago. We are able to see in the brain where we make a difference. We're using functional magnetic resonance imaging, where we're actually looking at where parts of the brain that are functioning, that are injured, that are impaired when people present to therapy, and we're able to design these different techniques to reach them, just like the antibiotic that the doctor gives you for strep throat. It's an exciting time to do therapy, to work with people. So I'm very excited that your text brought these techniques out very early on. Hopefully this will help drive us through the semester together. Again, I look forward to reading your survey results tomorrow, and I will be in touch very soon. Thank you.